wait for it. You got it. In this video, we're going to talk all things rib remodeling, which is a new procedure. We're excited to offer it in our practice here in Miami. Hi, my name is Dr. Sidhbh Gallagher. I'm a plastic and reconstructive surgeon, and I'm based here in Miami, Florida. And I am one of the first surgeons to offer this procedure here in the United States through the minimally invasive way of doing it, which is rib scar. We're going to talk in detail about what exactly is involved, what recovery looks like, and which patients do best with this type of procedure. So one of the hallmarks of a feminine silhouette is what we call the hip to waist ratio. And typically we want our waist to be about 0.7 of what our hips are. So we want that waist to be snatched in, but that is not always easy. Traditionally, how we've done this is liposuction for a lot of patients, maybe some fat grafting to make the hips wider, a tummy tuck if you're a patient who is suitable for that, where we tighten the muscles on the inside. But in some patients, especially patients I've seen in my practice who are, let's say, assigned male at birth, so trans feminine patients, this can be really difficult because the ribs simply get in the way. And this can happen regardless of gender identity. Patients who usually do well with this procedure are folks who have BMIs usually of less than 30, and the ribs are just in the way of tightening in that waist. They tend not to have too much distance between the pelvis, the upper iliac crest of the pelvis, and the lower ribs, the 12th, 11th, and 10th ribs, which is usually the ribs that we focus on. And so I always say facial feminization has evolved over the years to involve bony work and really body contouring. This is the next frontier in body contouring, is safely remodeling the ribs in order to effectively get that waist. So a lot of people think that rib remodeling or anything got to do with ribs or bones sounds scary, but in truth, it's really not. This is actually a very gentle procedure. In the past, we had talked about removing ribs where you have to create a scar and go in there, but thankfully, Dr. Manzaneda, who is in Lima, Peru, pioneered what's called the rib scar technique, which means no scar. So it's literally done with a machine called a piezotome, which cracks just one side of the rib, and in this way, as long as you wear a corset, we are able to bring in that waist. And in some cases, we're seeing results 8 centimeters, 10 centimeters, kind of 2 to 3 inches off the waist in some patients, depending, of course, on what their anatomy was. So this goes beyond what we could ever achieve before with liposuction alone. And like I said, it's especially effective in trans feminine patients. It's possible just to do it alone as a procedure. A lot of patients do that, or they may add in liposuction, even tummy tuck at the same time. It just depends on what their individual wants and needs are from the surgery itself. So what exactly is involved with rib remodeling and the rib scar technique? So we do this as an outpatient procedure, meaning that an hour or two after the surgery, most patients feel well enough to go home. So typically we do it under general anesthetic. It usually takes me less than an hour. And like I mentioned, we do it usually with 3 little pinpoints on each side. And so after the surgery, most patients don't get much pain. When you wake up, we'll have a corset on you, and the corset is very important. We're going to be wearing that and cinching it in over the next 3 months after surgery. The corset's not too bad. Typically it feels nice and supportive after the surgery. We'll teach you after surgery how to do some respiratory physical therapy, make sure you're breathing deeply. A lot of people ask, is it a dangerous procedure? And what we're seeing in the studies is not really. Thankfully, most of the important lung function happens above where we're working. So we're down at the level of ribs 10, 11, and 12. And so that really doesn't involve much in lung function, and that has been studied in the past and found to be good or pretty much unchanged. Compared to other plastic surgery procedures, it's actually a lot safer than a BBL. Injecting fat can cause embolisms, that sort of thing. So statistically, even though it may at first sound a little more extreme that we're working on ribs, we're leaving them in there, we're just changing the shape, and it is overall, I would consider, a very safe procedure. We're accepting new patients for this procedure here in Miami, Florida. Typical downtime is 1 to 2 weeks, really depending on if we do other surgeries. And the main restriction is you gotta wear that corset for 3 months after surgery, or it's just not gonna work. You have to do your part to narrow in that waist as well. We just make it so that the ribs can move for you. So reach out to our office. We're accepting new patients for this. Thank you for watching.